Hello, this is Dr. Phil Bresnian of Indian Valley Podiatry Associates with offices in Souderton, Harleysville, and Lansdale, Pennsylvania. Our website is www.indianvalleypodiatry.com. I would like to speak to you for a few minutes in this video regarding the adult flatfoot deformity. It is a very common problem and is the precursor for many other conditions that one sees during their adult lives. These can include things such as bunions, heel pain, hammer toes, and eventually lead to arthritis, not only in the foot, but in the knees and hips as well. There is a misconception that this just started recently. People tend to associate it beginning with the onset of their symptoms. However, this condition has been present for many years and is often present at birth, and it just takes a lifetime of all the steps you take during your lifetime to cause these types of problems. So I like to consider it progressive instead of developmental. The typical findings include pain in the foot, which can be general in nature. It can also occur in the arch specifically, as well as the heel, and even on top of the foot at times. It is usually aching and throbbing in nature and tends to be worse the more that you are on your feet. The cause has to do more with a misalignment of the bony nature of your arch than it does with the actual bones themselves. In other words, the bones are fairly normal, but the position and the alignment of the bones that comprise the arch are not normal. This causes the bony arch to sag, and unfortunately, that ends up being like standing on a bag of marbles, and the bones don't support the body weight that's above, and it tends to just collapse. And this puts extra strain on the soft tissues, including muscles, tendons, and ligaments, which leads to the pain. Treatment includes addressing a couple of different factors. One of the most overwhelming problems that we have treating this is that almost all people with a flatfoot deformity develop a tight calf muscle. It's hard to associate that with being flat-footed, but these are all links in a chain. The calf muscle tightens over time because it is forced to work harder with every step, since that flat foot is less stable and less effective when we stand and when we walk. To deal with this, we'll have to refer you to another video because it's fairly extensive. Please check back for that. The second thing that needs to be done is an attempt to try and stabilize and realign the bony arch structure. With conservative treatment, it can only be done with either over-the-counter types of arch supportive devices, which are worth trying because they're relatively inexpensive and can be helpful in some cases. However, many are inadequate. A prescription custom-molded foot orthotic does a much better job of supporting the bony arch and realigning it to some degree, but it still has limitations since any device is working from outside of the body, trying to control the bony structure within. Finally, there is a minor surgical procedure that can be performed under local anesthesia to realign the bones of the foot without cutting any bones. It's fairly minimally invasive, which does not lead to a prolonged recovery period. I hope you find this information helpful, and if you have any other questions, please contact us at www.indianvalleypodiatry.com. Thank you, and stay well.